have that coming up. I'm Dr. Enoch Choi. I'm over at Palo Alto Medical Foundation. My partner in crime, Jim Schweikartas, is here. He leads our emergency preparedness team at the clinic, previously at Stanford. And they've just done a wonderful job at responding to the recent threat of H1N1, activating our pandemic plan that I'll speak shortly about. We intended Ken to review some of the local resilience that we have, resources in our community, but I'm not sure that we have time. So we're
going to skip that, and everybody will thank me later for skipping that.
So we'll go really quickly through pandemic flu and how H1N1 is applied specifically to the problems of pandemic. In a pandemic, you will find that there will be one. Sometime in many of our lifetimes, there's been 3 in the last century, and it will be inevitable. If H1N1 does not become, there will be a pandemic. There will not be a magic bullet. There's not a treatment that's immediately available for a pandemic that I'll speak to shortly. And what should you do to prepare? Next slide. We're here because we want you to have resilience. We want you to be prepared, and we're so excited. So many of you are very into this. If you are able to prevent spread of infection, prepare for disease that comes, respond and recover, this is the way that we intend to have a resilient community, and so many of you are into being able to be a part of that process. Next slide. Pandemic flu is a new virus. This is a virus that no one in the world has had exposure to. And because of that, there are no antibodies. None of us have any resources within ourselves, within our past exposure to pathogens, to respond. And that's why it can become more deadly than seasonal influenza. The current H1N1 has not resulted in more serious illness, but it could become because it's a new virus. Next slide. H1N1 influenza is not yet pandemic, but it's almost. It's renamed from swine flu. It's a non-human virus that caused illnesses in pigs many times in the last century. Some of you have known in 1976 there was a large scare of swine flu that many people received immunizations and actually got more sick from the immunizations than the swine flu. Unfortunately, this time swine flu combined with human flu, and it's adopted the ability to spread from human to human. And because it started to pass from human to human in a large scale in the Americas, the WHO raised the pandemic alert level to 5. And it may rise to 6. At level 6, they declare a worldwide pandemic. The reason why they haven't done so, even though Japan has a sustained outbreak, where we have in another continent sustained person-to-person transfer, is because the illness hasn't been so severe yet. So there's a lot of pressure not to declare a pandemic because of the economic problems that could bring of shutting down and causing people to have social distancing. Locally, we have 31 cases in Santa Clara County. We've seen 1 at Palo Alto Medical Foundation. Over 5,500 people nationwide, and we've had yet another death today of an infant in New York City. So right now, it's not as deadly as flus that we've seen in the past, even our seasonal influenza, but it has the potential. In 1918, the Spanish flu killed 500,000 people, and so that's one of the concerns that early in the Spanish flu, there was some less severe illness, but it did mutate. In 1957 and 68, there were pandemics that killed less people, but still had significant pain and suffering. Next slide. So what's true about pandemic flu is that you'll need to be on your own. Society will break down because of needs for social distancing. And as you see now in New York, they're shutting down schools that have been exposed, such as the assistant principal who passed away recently. Even locally, you could see that some of the local schools with students that had H1N1 had to close. And if that happened on a large scale, you'd see much of society shut down because of the breakdown of our just-in-time processes. Next slide. Next slide. And the reason why this is different from many other disasters, such as I helped down in New Orleans after the flooding there, is that the duration of the disruption is much greater. There's not the idea that local aid outside of your local disaster area could come to your aid. This will affect the whole world and will make it such that only people who are prepared, yourself, without the need to rely on external support, would be able to last through the duration, the 6 to 8 weeks that you'll have disruption. Next slide. We're vulnerable because if you see what happened just recently, our supplies are quite just in time. If you tried to get some Tamiflu recently in the H1N1 outbreak, you wouldn't be able to find it except for in certain places that were very, very strictly dispensing it according to rules. We were out all over the city. And that was nationwide, similarly. Other than medications, you'll find that possibly breakdown with other supplies, say from groceries and other needs. So it's because of the great degree of infection that could spread that so many people would have to stay home, and you wouldn't want to be gathering and going out if you could bear it. What might help in here? We could be overwhelmed in our hospital beds and ventilators in the intensive care units. There could be up to a third of the population that could get sick, and this could be a serious disruption to our functioning in society. Next slide. So what if you had to stay home for a month? What if you had to stay home for 2 or 3 months? What if your schools were closed? Recently, we had to test our preparedness at my school to see if we could notify the parents and could those parents have childcare for those children. What if your power, what if your phones went out? What if your water system failed? Would you be ready? And I'm so glad that so many of you with the orange vest on, and I'm a BPC as well, have thought hard about that and are encouraging our neighbors to become more resilient and to be able to be more prepared. What if there was an earthquake in the pandemic? I don't know if Judy's here, but that's her.
She's in the back.
She's here.
Good timing.
Judy's here. There she is. Okay, what if there's an earthquake in the middle of a pandemic? And you'll have to think about if you're ready and prepared for that. Next slide. So consider what just happened with H1N1. Palo Alto Medical Foundation, just like the other local health providers, saw a surge of 30% increase in our volume, greatly outstripping our ability to care for these people who are coming in to seek care for possible H1N1. So we were trying to encourage as many people to do care by phone or over the internet with PAMF Online. You could see that the county and Kaiser set up tents to manage and triage people outside of the facilities to see if they could screen people. Local pharmacies all ran out of Tamiflu. We had a number of local school closures, and the social distancing recommendations of if you have a fever and you have either a sore throat or a cough, then you could possibly have H1N1. And as long as you're not too sick, you should stay home for at least 7 days after the start of your symptoms and until your symptoms are gone. And are people doing that? I don't think so. They don't grasp the seriousness of the ability for this to spread and develop. And unfortunately, the virus continues to spread. Fortunately for us, the virus is not very serious right now. It doesn't have high virulence, meaning that people are not dying in large numbers from it, but we would worry that it could mutate and take on those features. Pandemic influenza in today's world. We have all this worldwide travel. Japan's attempts at keeping it out of their borders by quarantining planes and keeping people. If you fly, my wife's from Singapore. We fly into there at different times, and there's temperature sensors that you light up in all red if you have a fever. Those efforts have limited utility. They're not proven to help because the problem is that you could be transmissible. You could transmit this a flu or other virus up to 2 days or more before you actually have symptoms. So as you can see, Japan's starting to spread even in such a very protective, sterile environment. Next slide. So what you can do is to try and prevent yourself from getting pandemic flu in the first place. There's no vaccine for pandemic flu, and it would take, for example, at least until September for us to have a vaccine for H1N1, even with advances in vaccine technology. Antivirals are in short supply, and you don't know whether or not